And while the plans for phase 2 are laid out, we continue to look and track the updated statewide coronavirus numbers for you. Today, state health officials reported 422 new COVID-19 cases. That's our lowest total in over a week and brings the statewide total to 20,122. Now, some positive news we do have to go along with that is the lower case number is that testing is also remaining high. In the past 24 hours, there have been over 10,000 tests conducted, making it the 9th straight day that we've hit high or above DHHS target range of 5,000 to 7,000 tests per day. On a more somber note, the death count has increased by 11 more people, bringing that overall total to 702. To look at those numbers again, go to our website, cbs17.com. I know that is a lot. Now, those numbers are just one set of several that state leaders are watching as they prepare for the second phase of reopening. CBS 17's digital data reporter Jody McCreary back tonight, digging deeper into whether or not they've gathered enough of those figures to make an informed decision.
With phase 2 on the horizon, there's still one big question. Does the data paint the full picture of what's happening during phase 1? Maybe not. That's because after you become infected with COVID-19, it takes some time before you show symptoms, and even longer before you get a test or wind up in the hospital. According to the CDC, the incubation period of COVID-19 averages 4 to 5 days, but it can be as long as 2 weeks. It's only been 12 days since the move to phase 1. That means someone infected early in that shift still might not be showing any symptoms. And then there are the hospital numbers. According to the American Council on Science and Health, there's an average of 5 to 10 days between when you get infected and when you check into the hospital.
Hospitalizations tends to be a lagging indicator, so it very much to me says, is this telling me something about something that happened last week that we need to be aware of?
I spoke to Pia McDonald. She's an expert at RTI International. She says because of all those lags, leaders should consider at least 14 days worth of data before making a decision.
Some of those data points that we're looking at have shorter delays than others. So it's important to know which ones we're looking at and how much delay is built into those trends.
Cohen says the state is looking at 4 key trends, not just one, to get a fuller picture of what's happening. But we found one of those trends might not be pointing the right way just yet. We'll tell you which one at cbs17.com.